This is Dr. Russell Robbins, Chief Medical Information Officer at Purple Lab, and you're listening to the Pharmacy Podcast Network.
You're listening to the Pharmacy Podcast Network.
Are you ready to unlock the power of healthcare data like never before? Meet Purple Lab, the innovative health tech company that is changing the game when it comes to accessing valuable insights in the world of healthcare. Purple Lab is on a mission to democratize access to data at scale, putting the keys to better healthcare outcomes right in the hands of customers. Discover the future of healthcare analytics with Purple Lab, your new best friend in healthcare analytics.
We are in the first quarter of 2024, and as of 2022 study that was taken by Enterprise Apps Today and Psychology Today, it said that the most common New Year's resolution in the United States of America was to exercise more, and even up to 48% of the people polled said that they want to lose weight and they want to get in shape. And it's this cycle that, I don't know, humanism seems to go through. I have to admit, I do want to see shedding about, I'd say I need to shed about 15, 20 pounds, but I'm all right, but it needs to get back into it. So I have a friend of mine who I met through the National Association of Specialty Pharmacies, and I'd like to introduce Russell Robbins, Dr. Russell Robbins, Chief Medical Information Officer here at Purple Lab.
Great. Thank you, Todd. I'm glad to be here on the Pharmacy Podcast Network talking about topics of interest to different clinicians and pharmacists in the industry.
So, Russell, what do you think of the stats that I shared with you, and why do you think that we go into this perpetuating cycle as humans that new year gives us an opportunity to maybe reset and shed some pounds that we don't need to have on us?
No, it's always an interesting question. Why is that magic, change of the calendar the day we do it when you could theoretically start any day with a new resolution to get in better shape and lose weight? And it was funny. One of the classes I take at our local Y, we have usually about 5 to 10 people in the class, and on Saturday last weekend we had 24 people. So so everybody wants to start, and I think it's great that we all want to do this, and we all can start at any point, and as long as we continue, and as long as our commitment stays there, it really doesn't matter when you start, and now's as good a time as any.
Yeah. Wow. Well, when we talked the first time, it was at the NASP, and you gave us some insight into what Purple Lab is and what your commitment and goals are. But just for listeners who didn't get to hear that episode with you, give us some background on yourself and the mission at Purple Lab.
Oh, great. I'd be happy to do that, Todd. So we are, Purple Lab is a healthcare claims data aggregator. So we take medical claims and pharmacy claims. We link them together in our Health Nexus platform. And in addition, we also take social determinants of health information, and we link that through a de-identification tokenization process to each of the medical and pharmacy claims. So what we're able to do in the Health Nexus platform is look at any given physician or any healthcare provider in the country and see what are the demographics of his or her patient population compared to others in the same specialty, in the same region, in the state, or nationally. And similarly with medications, we can look at any given prescription, whether it was written or dispensed, and see what were the demographics of the people who got that prescription, and also what were the demographics of the people who tried to fill the prescription but weren't able to.
Does this play from a traditional community-based formulary and dispensing from that environment versus a specialty pharmacy? Is Purple Lab feeling as if your services are more needed in specialty, or are you seeing Purple Lab go throughout the different sectors of where pharmacies are?
Yeah, no, we see it across the entire pharmacy spectrum. So we have developed our own methodology for specialty pharmacy. We've also worked with organizations such as NASP to look at the specialty pharmacy lists and providers that they have and link that to the medical and to the claim. So we can look at any given prescription, whether it's in specialty or not in specialty pharmacy, and see who's prescribing it, where is it being prescribed, who's filling it, and again, taking all of this information into hand, it really helps understand healthcare costs, healthcare trends, whether you're talking at it from the big pharma company perspective, the health plan perspective, the provider perspective, or even the consumer perspective. You really have insights into the data through the Health Nexus platform that you won't get from any other way to look at healthcare data.
So pulling us back into how we kicked off our conversation, there are a lot of controversial posts, news coverage, people following up from the 2023 publication through the Globe and Mail, who had a big research and story that came out that was titled, "A Weight Loss Drug Everyone Wants is Exposing Myths About Obesity." And within that article, it talks about physicians who have worked in helping people with obesity from, this treatment modality and clinical oversight, medication changes, things like that you're really digging into it, has now exposed more data around what is obesity and really dissecting and demystifying it, which is wonderful. I think of organizations like IntelliHealth. I think of obviously Purple Lab and what you're doing. I think of some of the specialty pharmacy management systems that are focused on specialty, which this all works together. So when I'm talking about the popular drug that I don't think people really understand what's even happening, Wegovy and Ozempic, and you think of the opportunity that now is rising with what technology you have specific to that condition and disease state, open up with our listeners a little bit about your insights and your ideas around that kind of data access and usage in order to really help people live better lives.
Yeah, no, thanks, Todd. So yeah, we looked, our database goes back to 2014. Obviously, with the semaglutide drugs, that's more of a recent phenomenon. So, so we don't have to go back to the beginning of our data set. But when we looked, I looked recently for prescriptions from October of 2022 through October of 2023. And what we saw in our database is we have about 2.8 million people who have had a prescription for one of the semaglutide drugs dispensed. And so, that's kind of our starting point of, we have the breadth of prescriptions in there, and now what do you do with that information? How do you start digging down to see what's going on? So we can look at it from which states are, where are the highest number of prescriptions, either at the state or the 3-digit zip code level? Are there certain individuals in different socioeconomic groups or race or ethnicity groups who are getting the drugs or not? How does even men versus women getting these drugs differ? And that's really where we can start to see, who's getting the access to it, and are some of these stories in the popular press about, people, just getting the drugs with no indications, or just, it's only the wealthy people who are getting the drugs. Is that really true? Or is that just, again, going back to some of the myths around not necessarily obesity, but about the treatments for obesity?
So in backing up, it's also teaching our providers, our physicians, specialists in obesity, and of course our specialty pharmacists, that there's something now more to obesity than what we originally had thought, based on the data that's outcoming, and the outcome for the correlation between diabetes management and obesity. It really opened up a new can of worms that's filled with data. So do we back up and say, what country throughout the world has the highest level of obesity? I'm sure this is a something that you could probably Google. Um, and what I'm saying is it beginning as children? Is it beginning as teenagers when we're in our puberty stage, where we're on diets and we're eating food that is so high in processed and high in sugar and high in things that it's almost making us pre-diabetic from a very early onset? And is there any data that you have to kind of pull out components around adolescents and GP1, for example?
So yeah, so we can pull out information about adolescents, who are getting these medications. Obviously, some of the lifestyle choices, the dietary choices, these have been issues that I've been dealing with in healthcare now for the last 20, 25 years. So, so those issues haven't really changed. What has changed is some of the underlying treatments that are available. So with the approval last year of Wegovy for adolescents, we pulled some data here at Purple Lab to see what was happening, for that. Were people, in that age range getting the medications or not? And what we saw there is when we look at when we looked at that, just for the 12 to 17-year-old population, we had several thousand adolescents who were getting the medication. Obviously, because of HIPAA, we can't look at the social determinants of health factors there. However, what we did see is it was about almost an even split between commercial and Medicaid. So if you think that Medicaid is serving a lower income population, we can see that for those teenagers who needed to get access to the medication, and income by itself was not a barrier. So I think that for me demystified one of the the myths out there that only the rich kids get these drugs and it's not the poor kids who get them. Really, anybody who has the clinical need to get these medications is able to get access to it.
All right. So what about transitions of different treatment and different care? I think of stomach surgery for the right candidate of someone who is obese, or someone going through bariatric surgery, whatever that is, whatever combination. So talk to us about drugs after bariatric surgery, for example.
Sure. Yeah. So it's interesting. I've been doing some research about this. There is a trend that's appearing now that people who get bariatric surgery are also being treated at the time of the surgery with some type of semaglutide. And why we're seeing this in about 15% of the patients who have the surgery are getting these drugs. And we're seeing this for a few different reasons. One is some physicians feel that this supports and maintains the initial weight loss by suppressing the appetite, so it prevents people from having good initial results and then slowly start to eat more and more and lose the effects of the bariatric surgery. We're also seeing some other reports out in the literature saying that these types of giving the medication right after the surgery also helps prevent further complications downstream. So I think it's still early to see, is this, going to become more of a standard than not? But, in about, as I said, 16% of the time, we're seeing this happening. So obviously, this again may be one of those myths about obesity and obesity surgery that needs to be either proved or disproved in the future as to whether or not giving the medications at the time of surgery makes sense or not. I think further trials will bear that out.
Excellent. So I cannot stop thinking of some other conversations that I am going to need to plug you into. I want to also give a shout out to our pharmacists who are focused on helping patients dealing with obesity. Make sure that you hook up and connect even through LinkedIn with Russell. Russell, what's your preference of connections with people for collaboration, as well as maybe some future panel episodes that we could be doing together?
Sure, either LinkedIn or directly through my email at Purple Lab, rrobbins@purplelab.com.
rrobbins@purplelab.com.
Yeah.
Look,
2 R's, 2 B's.
Yes. Russell Robbins is Robbins, and you will find Russell on LinkedIn. I'm excited about some of our future topics. Something I want to just tease out for our listeners, especially if you are a pharmacist. Once again, today's episode around obesity specifically. However, we're not limited. Next time, we'd like to dig into migraines, and there are specialty medications and specialty treatment programs that tie in a multitude of factors, especially if someone's comorbid and dealing with some other medications for another situation or something you're going through. But Russell, can you give us a little preview of what we're going to be talking about in the next episode?
Sure. So one of the things we were looking at with migraine headaches is access to care and looking at changes in patient preferences for provider selection. So what we found, what we can start to look at is when you have that initial migraine, where do you seek care? Once you start getting treatments for the migraine, whether it's with medications or alternative type of medical treatments like acupuncture, does that interaction change where you go the next time you need migraine care?
Excellent. Excellent. Well, thank you, Russell. I want to thank the Purple Lab team for all the work that you've put into this new programming. We also want to give a shout out to our listeners, to our specialty pharmacists, our community pharmacists. If there is any subject matter that you hear on any of our shows and you'd like to reach out to Russell or the team, please do so. You will see access and the LinkedIn connection in the show notes. Wait if you're driving or you're on your way to work, and reach out to us. We like working with pharmacists. That's why we've grown to a global publication, and that's why we have good people and resources like Purple Lab and Russell on our team. So thank you so much, Russell. It's been good to talk with you.
Great. Thank you, Todd.